I'd like to thank NIPEC for the opportunity, again, for inviting us to present what we do, and also the South Eastern Trust for recognising the hard work, I guess, that we do, and to put us forward as an appropriate service to speak on such a day where we're celebrating nursing. Today I want to talk about nurse education to reform services, and in light of that, looking at the impact of non-medical prescribers within ADHD services and how that has increased our capacity. So ADHD is the most prevalent childhood condition with a global incidence of 3 to 5% of school-aged children. We, in the South Eastern Trust, we very much go on our NICE guidelines. We assess, diagnose and manage based on what NICE is telling us where possible. It's a busy, busy service. So we could spend the 15 minutes talking about ADHD, but we're going to do a very quick just recap of what we're talking about here. So when we talk about ADHD, we're talking about 3 key areas of the brain. We're looking at the cortical region, such as the prefrontal cortex, which is very much involved with your attention and your emotional responses. Your subcortical regions, such as the limbic system, which is very heavily involved with anxiety and how you manage your anxiety. Not very well for me at the minute. Your basal ganglia, which very much receives all the information and processes it and sends it to the right part of the brain at the right time, and the cerebellum. So all these key areas of the brain within ADHD are underdeveloped, and they're very much lagging around a third behind those of their peers. So you can imagine the difficulties that causes, and it very much presents within, here we go, within these 3 domains: the inattentive, the hyperactive, and the impulsive. So within ADHD, we used to talk about ADD, which would be your predominantly inattentive profile, your combined presentation, where you've got a little bit of everything, and your hyperactive, impulsive presentation as well. Why treat ADHD? Well, I'm going to show you why we treat ADHD. So, longitudinally, we know that children with ADHD and going forward into adulthood will have much poorer outcomes, very significant decreases in their potential. So we can see up to 20% are more likely not to complete secondary school, and even if they do manage to get through secondary school, they will underperform to what they are capable of, and that's very understandable whenever you talk about a brain that's running a third behind in development. They're really up against it from the get-go. They're 30% more likely to have a teenage pregnancy, and that will come alongside the impulsivity and forward planning and inability to do that. They very much like to act in the moment, which can lead them into difficult situations. 25% more likely to engage in substance abuse. Substance abuse is very much can be a dopamine-seeking behaviour. It's looking for excitement, or we can look at it in another way. We can look at it as it's an attempt to self-medicate the difficulties. If they're struggling to understand themselves, they will turn to other substances to try and treat and look after themselves. 30% more likely to be arrested, and 20% more likely to go to prison. So not only is there a very human reason to treat ADHD, there is also a huge public health reason to treat ADHD, and our longitudinal studies very much suggest that children that come in and receive treatment have significant decreases in all these domains. Within the South Eastern Trust, we have a very large ADHD service. We have 2,800 patients that are aged between 6 and 18 years of age. The reason they come in, the reason it starts at 6 is because that's the age that we assess for ADHD. The brain is very much still developing, and therefore we give them time to see where we end up with, and then we assess at 6. And then at 18, although we are talking about that, we can transition across into adult mental health services, so it's not a stopping point. Referrals into our service have increased 44% over the last 3 years, which sounds quite scary, but actually it means we are starting to get a lot better at identifying children with ADHD, taking action, assessing and treating, and improving outcomes for these children. There's a number of reasons why we think referrals have increased. We think we have better awareness in schools. We have a health RISE NI team that is working across all the trusts. They are very good at spotting children with ADHD. There appears to be thankfully, dissolving stigma around ADHD, something it very, very much suffered from whenever it first came onto the scene and was first diagnosed, assessed and treated. It is, as we know, a highly genetic condition, and the evidence, the MRI evidence with the brain scans and things that we were looking at would very heavily back up the existence and reality of ADHD, and that message is finally getting out there, which is great. We also, traditionally, would have got a lot of boys into the service. The research would say the boys' incidence is around 5% and the girls is more closer to 2 to 3%. However, that may be for a variety of reasons, but our girls tend to be a little bit more inattentive, so therefore can go under the radar, particularly in the education system. If you have a little boy who's very active, very busy, he stands out, he's much more likely to come to services attention. So we're also seeing an increase in girls, which is great. So NICE guidelines, as I said before, very much guides our practice. Children receiving medication management for symptoms of ADHD, they require a 6-monthly health check. Now NICE, when I say about the medication there, we can use non-stimulant medication or stimulant medication, and NICE guidelines very much guides our practice with that. But any child who does go down the treatment option of using medication to support their impairment, they need a 6-monthly health review. Okay, so they will come into clinic, and we check them for efficacy of treatment. Side effect exposure, the medications we use aren't perfect medications by any stretch of the imagination. They have significant side effects in terms of appetite reduction and delayed sleep onset, so it can be that wee bit harder to get to sleep. We carry out a health review, including height, weight, and blood pressure within clinic, and we also take that opportunity to carry out a lot of psychoeducation. By psychoeducation, we're really trying to improve the environment around the child, improve the understanding, and also teach them about their condition, and also their parents about the conditions. There's a lot to cover, as you can see, in a 30-minute appointment. So I want to introduce the SET nursing team. Some of them are over there. We've got some pictures coming up here. So we have one whole-time equivalent service lead. It's Carol Sibbald. And then we have 3 0.5 whole-time equivalents, which I am one of. And I'm based over at Scrabo Children's Centre. The 3 senior practitioners within the team also work into the neurodevelopmental team, which looks at complex presentations of autism and complex presentations of ADHD. Okay, so my other colleagues who are with me here to provide some moral support are Julie Jackson, who's based in Warren and an ARCN nominee for Nurse of the Year last year. And we have recently had Veronica Bailey, who's based in the Down Children's Centre, who has joined the team and has promptly taken herself off to go back and fulfill her master's, which is great. So it's a fantastic team, and it really helps because we are all hugely passionate about ADHD. Once you start us talking, it's very hard to stop us. Sorry, I've covered this. Sorry, that's added in since the one I've been looking at. So, what I didn't say there is we are all non-medical prescribers, and that is very much the crux of what I want to present today to you. We, the ADHD treatments, as I said, are stimulant and non-stimulant, and they fall under the guise of being controlled drugs, and it was legislative changes to the legislative changes that led to the nurses being able to prescribe those. So that has brought about the availability of us to be able to enter clinics and overview the clinical picture with these children. We enter into shared care arrangements with GPs to fulfil prescriptions on the advice of the hospital-based specialist. Our non-medical prescribing course, just wanted to talk very quickly about that. It is available in the University of Ulster and the Queen's University Belfast. It's a one-year programme which combines placement with study, but very intense year. There's a few of my non-medical prescribing colleagues in the audience here that I was talking to during the break. Very comprehensive year, but the beauty of it is that you get to study appropriate to what the area you're working in. So I very much spent a year looking at all the research on ADHD, all the medications. All my assignments were completed in respect of the ADHD medications that I would be using in practice. So it was absolutely brilliant. Really enjoyed it. And that combines, the completion of all our modules combines to equal safe and effective care. So the impact of nurses within the service. So we have gradually grown our numbers, and with that, with our rapidly expanding numbers within our service, we generate a lot of medication reviews. And in fact, in 2019, we had 3,788 half-hour review appointments, and the reviews completed by a nurse in 2018 were 2,186. Prior to that, those would have been completed by specialist registrars and upwards right through to community or consultant paediatricians. So we don't need to spell out the impact and cost saving there to anybody. And that transpires to be 58% of all medication reviews now completed by a nurse instead of a doctor. We did for NIPEC take some service user feedback. Everyone was saying it was interesting because after I'd taken this feedback, I actually looked at a document that was brought together with the Wish Foundation. I can't remember who brought it together, but they very much were saying exactly what we were getting back from our patients, that they appreciated timely reviews, they were happy with the level of care received in comparison to the doctors. They felt that the nurse adopted a whole family approach. They felt we were incredibly patient, helpful, attentive and professional. And one parent commented, which was one thing that we wanted to bring here because we really liked it. They said it's doing the simple things well and promptly that makes a difference when you have a child with ADHD. And it's so true because it is very much life on a roller coaster for our parents looking after our children with ADHD. It can be very difficult. So they need that responsiveness in the moment as opposed to 2 to 3 weeks later when someone has space to get back to them. Our aspirations for the future. We would like to set up an ADHD youth forum. Further development of our current parent and training and psychoeducation. We are always working and thinking how we can adapt our service and make it better. We do think we are ideally placed for a QI project and an SQE project. Our difficulty sometimes comes whenever you work in a busy service. It's time to get that space. Difficult to get that time away to complete it. And through gritted teeth, we are going to consider the advanced nurse practitioner role when it comes along, and that would be particularly useful when we look at going on to the next level, which would be diagnosing children with ADHD and looking at differential diagnosis, because a lot of other conditions can look a little like ADHD as well. So, wanted very quickly to look across to my table here, and we just wanted to take this opportunity as well as a team within Southeastern Trust. We are losing Carol Sibbald, who is our service lead. She's in her final year of service, and she is very much a pioneer and embodies exactly everything that people have been talking about today. She is so heavily invested in education in nursing. She was the first person right at that 2012 to go away and get her non-medical prescribing, spot that opportunity, get in there and set up the service, and she has driven it forward herself. She is, not only that, she's just an incredible manager, an incredible person. We're all so fond of her, and we're devastated that she's going to be leaving us. So I'd like to thank her for all her service over the years.